The next speaker of the day, who is a gynecologist from Canada. She studied from King's College London, a very promising and very competent doctor, senior consultant, OB gynecologist, and laparoscopic surgeon. Please welcome Dr. Yasmin Sardar.
Bismillahirrahmanirrahim. Assalamu alaikum, ladies and gentlemen. I'm Professor Dr. Yasmin Canadian Pakistani, the CEO of GMS Solution Canada, a platform of health and wellness for women and children. I'm honored to be here in the conference organized by Berkeley and MS Voice of Global Women. I'm so happy and excited to be with Her Excellency Aarefa Falahi and all the distinguished guests who are here to support women empowerment for such an important subject, the most preventable public health issue, breast cancer awareness. I'm very thankful to the host of the conference, Prof. Dr. Musa Shaikh and his team. We are indeed very fortunate. Not only the women of this region in UAE and Middle East, but across the planet, across the globe. We are so thankful to all those people who are gathered today to make this conference success and to make some actionable actions to be taken and the message, and looking forward to make the world cancer-free for all the women. As I said, it's so important to talk about the breast cancer because it's most common after the skin cancer. The important message is that it's the early detection and awareness which can save the life. First preventive step towards the prevention of the breast cancer is make the public aware. So empowering the women through education, screening, and support. It's a backward, remote area of one of the region in Pakistan, where they came to me and said, ma'am, we cannot teach our young girls about breast. It's a body part which we don't talk about it. And I told them, when you teach your child ABC, why don't you say, instead of saying baby, B for baby, B for boy, B for, why don't you say B for breast, self-breast examination? I take an opportunity and teach every young girl I come across, come here, and I take them in a private place and I say, hey, this is at risk. In my clinic, every single woman, I examine the breast, and it's very simple, as you can see on this one. Once in a month, I say either after the menstruation, when you are taking shower in your body, just wash and palpate. There are different ways, up and down, or circumferentially, or radiating pokes. Like you feel any lump, then you need to see your doctor. So the breast self-examination, the various, and here is, and the second is the clinical, after clinical breast examination, it's a mammogram. which is important, mammography. There are various myths. Women, they get scared. Oh, I may get something out of this. And I reassure them, they need support. First, the radiation dose is very low. We are going to diagnose at early stage. If we picked up breast cancer early, your treatment and the treatment can lead to 100% survival. There are stages of the breast cancer. So mammogram. Now these days, from digital mammogram, there is a contrast, there's enhanced imaging, which can help. So self-breast examination, clinical breast examination, and various colleges have the guidelines. And mostly they are saying that if you have the family history, the mammogram should be done at the age of, earlier than age of 40, because, and about 5 to 10 years earlier, where your first degree relatives, they were diagnosed with a breast cancer. A clinical breast examination, the doctors, I would like to take an opportunity that if the woman comes with vaginal discharge, please do not focus your examination only on the vaginal part. Or if it's a GP and you're seeing a woman, please take an opportunity to offer the clinical examination. Because the important thing here to learn is that there is a lack of equity in healthcare of the women. We all agree. There is discrimination because of the lack of resources. It cannot be the same care in UK and Canada, and I'm sure in UAE the same as it's in Pakistan, Sudan, or Egypt. So we are having the opportunity to examine the women clinical breast examination once in a year at least, and make it a point. There's no hard science about it. We are entering in the most modern era of precision medicine, where genetics, lifestyle modifications are incorporated. This slide is showing that it's a simple examination where the women stand against the machine and a small dose is given and it takes an X-ray. There is an ultrasound before that, and ultrasound can detect whether it's a solid mass or it's a benign mass, and it can differentiate. Then if there is a lump which is diagnosed during the self-breast examination, clinical examination, or on ultrasound, is a needle-guided biopsy, which very women, they come and they say, oh, I'm so scared, I'm not going to do this test. And at the end of the presentation, I will share the very sad story of 2 of my patients who just refused this and a simple test because of the cultural inhibition. Again, emphasizing that it's a common issue, it's a global burden. 1 in 8 women will be diagnosed with breast cancer, 2.3 million women, new cases annually, and developing nations face the tragedy of delayed diagnosis and ultimately leading to the maternal deaths, leading to women deaths. And this is a very, very common scenario that they are never getting opportunity. They were not aware of self-breast examination. They were not taught, and there was no awareness of importance of self-breast examination. So risk factors, like any preventable condition, is very important. We can divide them. They are modifiable and non-modifiable. Once can modify, of course, that is the age more than 40 years. Being a woman, we are all at increased risk of breast cancer. The genetics, the family history, we cannot change the genetics. But what we can do the genetic testing, BRCA1 and 2, genomic studies, entering towards, again, the precision medicine. Certain risk factors need to be identified. If a woman, age of onset of menstruation, menarche, is early, and the late menopause, so there is a longer exposure of the breast to estrogen hormone, makes a woman vulnerable to breast cancer. There are certain modifiable risk factors, and if I will give you important information today, that genetics take a small component of the breast cancer. That's very happy news. And the major chunk comes from the modifiable risk factors. And what are the modified risk factors? They are obesity, sedentary lifestyle, smoking, alcohol. These are the things we can change And I would again urge all women healthcare professionals who come across with women here that please take an opportunity, take a moment to talk to the patient, every single woman they encounter, about the public health issues. This is my practice, that I talk two important things rather than three. One, I talk to them about young women, the importance of getting their daughters HPV vaccinated, 9 to 14 years. And I come to them that all sexually active, because in Pakistan it's a cultural taboo, they attribute cervical cancer vaccines with the sexual behavior changes and so many other myths we need to debunk. Here is one myth, that cancer can happen only to the women. Well, we are lucky that men, they get 1% or less than 1%, but they have the breast and they are still at risk of breast cancer. Then it's more prevalent where the family, the first generation from the mother side, they are having cancer. Another common myth is that cancer can not happen before 40 or 50 because it's a late age cancer. Well, that is not true, because cancer can happen in even the teenage. If we come to the treatment, there are various treatment options. Here is just to educate that earlier the cancer is diagnosed, we are having better prognosis, better survival. And so what happens is that once it's early, localized, so you not necessarily have to remove the whole breast, as is the myth, that they cut your breast, they chop it off and will not look like a woman. And my husband would marry another woman. Please, if it's an earlier detection, earlier treatment is offered, it's only lumpectomy. Then it could be surgical treatment, then radiation. Sometimes we offer chemotherapy. Now the most modern is even the immunotherapy. So targeted tissues, they are given. Support system reduces distress. Holistic care, precision medicine, physical, emotional, spiritual healing. Please get the testing done. Important message over here is please look for, make a family pedigree, your own, out of interest, and give it to your daughters, that your grandma was diagnosed with breast cancer at this age. Your mom skipped it, but you are still at risk. Your aunt, first aunt Khala, was diagnosed by this. So girls will be educated. Take this information on your cell phone when you go to your doctor for annual checkup. Please share this information with your gynecologist, with your GP or healthcare providers, or the community, even the practicing nurse, that women health matters. Not only the physical, but the mental health is equally important. Thank you very much, and we pray best for the women's solidarity and best women health. Let's make our countries, all the women, free of breast cancer by educating our daughters, sisters, and our wives, if the men are in this audience. We train our nurses, midwives, we educate the schoolgirls about the self-breast examination, emphasize the importance of annual examination for breast examination, from head to toe annual breast examination, periodic health examination. And we are very thankful to Berkeley MS Global Voice of Women UAE and our host, Dr. Musa Shaikh. Thank you very much, and let's unite together to be aware of breast cancer. It's preventable, it's treatable, you can survive your own life spectrum if you are treated at early stage.
This was an amazing conversation by Dr. Yasmin. She is a great lady and doing a great job in awareness of women-related matters. Such kind of woman is an asset for the society. Ladies and gentlemen, now we are in the end of our conference, and I want to thank everyone to be a part of it. And I'm looking forward to see you next year in our Breast Awareness Annual Conference, which we conduct every year.